This is Sridevi Nursing Officer at AIMS Mangalagiri. So finally I came with another class today. We will discuss few more important questions for nursing competitive exams. So before going into our video, if you think this is useful video, please don't forget to like, share and subscribe to our channel. Let's start our today's class. So today's first question is, what type of bleeding will a patient with a peptic ulcer disease with a slow upper GI sources of bleeding we have? So options: option A melena, option B occult blood, option C coffee ground emesis, option D profuse bright red hematemesis. So here it will see first what actually examiner is asking, what type of bleeding a patient with a peptic ulcer disease with a slow upper GI sources. Upper GI sources means, see, if this is stomach, if we'll see this part is called upper GI. So upper GI, any bleeding is there. So that bleeding, it was crossing from stomach to duodenum, jejunum, ileum, large intestine and rectum. Through feces it will come out. So this is upper GI bleeding. What examiner is asking, if a person with a peptic ulcer, what kind of bleeding we can observe? So in this we will see what is melena. Option A, melena means old blood in a stool. That is called melena. Option B, occult blood. Occult blood means hidden blood particles in stool. Means that we can't see with our naked eye. That kind of particles, if it is present in a blood, present in a feces, that is called occult blood. For this identification, we will do Guick test. So that is occult blood. Coming to coffee ground emesis. Coffee ground emesis means old blood through vomiting. In vomiting, we will see a old blood emesis, means vomiting. We will vomit a old blood, that is called coffee ground emesis. Next, profuse bright red hematemesis means a fresh blood vomiting. Coffee ground emesis means old blood and profuse bright red hematemesis means fresh blood vomiting. So here patient got peptic ulcer. Peptic ulcer caused by H. pylori bacteria. So this is a not fresh blood. So it is generating in the upper GI, and from through this it was traveling from duodenum, jejunum, small intestine, large intestine, then it was adding in feces and all. So it was taking a long period to reach out. So that blood is old blood only. So old blood in stool, that is called melena. So here answer is hidden blood particles, no. Coffee ground emesis, they are not asking in the emesis. So bleeding, so here option C also wrong. Profuse bright red hematemesis wrong. So here answer is melena. Melena we can see in the peptic ulcer patients, which is included in a slow upper GI sources also. So this is option A is a correct answer for peptic ulcer patients. So next question. So next question is, identify the given image. What whatever image given in this area, so we need to identify and we need to give an answer. In a NORCET or mostly in the NORCET, they will ask at least 3 to 5 image based questions in examination. So images also very important role in a NORCET. Not even NORCET, some other exams, competitive exams also, they used to ask image based questions. So these kind of images also we need to remember what kind of item. Sometimes they will ask what are the use of this item, or sometimes they will give you like suture materials and all, or ICU, OT instruments. Mostly examiner will ask ICU or OT instruments. So whenever we are giving NORCET exam, we need to thorough with the ICU and OT equipments. Not only ICU, OT and emergency equipments like a crash cart items and all, we need to identify properly. So here whatever they have given image, that is bipolar cautery. Bipolar cautery. So this is bipolar cautery. In OT, we use when a surgeon is doing any surgery for a patient, that time they will use two kinds of cauteries. Cautery means that can be cutting, that can be used for a cutting of tissue, or that can be used for a coagulation of tissue to control the bleed. So these are two kinds of cauteries mostly, that is bipolar and monopolar cautery. Monopolar cautery. So in monopolar cautery, that whatever here shown image, that is monopolar cautery, that have only single tip. But coming to bipolar, we have bipolar cautery and monopolar cautery. Monopolar cautery are used for only cutting of tissues. Only for cutting of tissues during surgery, we will use monopolar cautery. Coming to bipolar cautery is used in a wet tissue, and this is used in a smooth tissues, and bipolar cautery is used for cutting and coagulation. So wet tissue we will use bipolar cautery, and small tissue, smooth tissues and all, we will use bipolar cautery. It will use for not only cutting, it will use in the coagulation also. Whenever a laceration is happened or any cutting is happened in that particular areas, like artery cuts or anything, in that duration, if it is in a active bleeding and all, that time using by this bipolar cautery, they will make it as a seal. So it can prevent bleeding and it helps us in a coagulation. In this bipolar, while using bipolar cautery, tissue damage is less. Tissue damage is less. So these are the main important things we can see in the bipolar cautery, and monopolar cautery also we will use it in a cutting, tissue cutting and all, we will use monopolar cautery. So this is about cautery which is used in the operation theatre. Next, move on to next question.